Okay. Well, welcome at today's webinar, Partnerships between India and the Netherlands in the field of zoonosis. My name is Davinia Lamme. I'm one of the directors of Larive International. We are a business advisory firm based in the Netherlands. We have been asked by the Dutch embassy in India to perform this study together with our local partner, Sanomes 4, part of the Seamless group. And today we're going to present some main findings, and hopefully we have interesting discussions today. Before we start, we have a couple of house rules. So the topic of today is collaboration. So we really try to aim to see what kind of linkages can be made between the Netherlands and India. We are with a relatively small group, but today it's about quality over quantity. So it's also interesting for us to know who's in this call today. So please make yourself, introduce yourself via the chat. You can use the chat and present yourself with your name, your role, and organization that you're working for. Also, please keep yourself muted throughout the presentation. If the presentation is finalized, there is enough room for discussion, and there's enough room for discussion. And please raise your hand if you have a question or you have some kind of remark. I will be your moderator of today, so I will ask you to speak out loud, and then you can unmute yourself. I also see that Rogier is recording this session. If you don't want to be recorded, then please turn off your camera. Let's make it a fruitful session for today. Today's agenda. First, we're going to get a warm welcome of the Dutch embassy and an introduction of this particular study. Followed by the situational analysis in India, which is being performed by us and the Seamless group. Then we're going to go a little bit deeper into the risks and challenges, but most importantly afterwards, the opportunities that we have found based on this research. And then we have room for discussions. And of course, then we'll end it with a closing. We have about an hour, so I don't want to speak too long. Let me shortly introduce you to the speakers of today. So we have Michiel van Erkel, who is the agricultural counselor of the Embassy of the Kingdom of the Netherlands based in New Delhi, together with his colleague Marcel Floor, Counselor for Health, Welfare and Sports, based at the Embassy of the Kingdom of the Netherlands in New Delhi. And then the presentation will be provided by Kshiti Gala. She's head of research and consulting at Seamless Global, and my colleague Niels Krijger, who is an emerging markets advisor at Larive International, based in the Netherlands. And we're getting the support from Prerana and Niels, who will chip in when needed. So please, I would like to give the floor to Marcel Floor from the embassy. Marcel, over to you.
Thank you, Davinia, and a warm welcome to all the participants in this webinar. For me, it's a great pleasure to be in this webinar. And at the same time, it fills me with a bit of sadness because I really enjoyed the meetings with the excellent colleagues of the Larive and of the Seamless Group in preparation of this report. And those meetings might come to an end with this webinar. And when trying to finalize this report, we were faced with recent developments that needed integration in this report. And to mention a few, the launch of the Animal Pandemic Preparedness Initiative, fairly recent, and only last week, WHO's declaration of the end of the public health emergency of international concern at last. So these rapid developments in this area, for me, have a meaning. And for me, as a positive character by nature, they mean that we are convinced and dedicated to change. We need to increase awareness and mitigate the zoonotic risks. And we're in this together, simple as that. Now, the complexity, either in substance or in governance, for me, cannot be a permanent obstacle to progress. And in order to help us understand the context in India, we, and it is as said by Davinia, the Agricultural Council in the embassy, Michiel van Erkel and I, with a background in public health, we jointly commissioned Larive and Seamless Group to help us overcome this obstacle of complexity and guide us towards more actionable interventions. And that's once again different backgrounds, but we're in this together. For me, it is absolutely clear that we cannot afford to lose the momentum. We can and will do better, and we owe that at least to the approximately 20 million people who died during the last pandemic. So I look very much forward to the presentation and the discussion immediately afterwards. And over to you, Michiel.
Thank you, honorable colleague in Delhi, calling in from Colombo at this moment. So it's a pleasure being here. And I would like to add to that, it's sometimes also about the economy. Yes, the pandemic has also shown us, blessing in disguise, the effect that it can have on our economy. And I think, and it's only natural, there's also money to make from a crisis. And in this case, the idea about zoonoses. Now, improving the situation, improving insights, transition will support consumers in India, producers in India, in producing a safer product and keeping the economy rolling. And of course, I mean, we have, as Dutch companies and Dutch government, we have also something to offer. I think that working together with the Indian economy, the Indian players in the Indian economy, we will be able to also make it beneficial to all actors in the system. Having said that, it's back to you, Davinia. Thank you.
Thank you, Michiel and Marcel, for this introduction. I further would like to give the floor to Niels, my colleague, who will further present together with Kshitij. So Niels, over to you.
Thank you, Davinia. Marcel and Michiel have already done a great job introducing the study and introducing the relevance of the topic of zoonosis. I will just take a minute to give you a little bit more context to the study before we dive into the specifics. So, as you heard, AMR and zoonoses are both topics of strategic importance to the Netherlands in India. And as you also know, AMR and zoonoses are not bound to formal country borders. It is well understood that we need to collaborate on these topics. And these reports are a starting point to that, or at least the way forward for this collaboration starts here. So in 2021, Larive, together with the Seamless Group, have also performed a study on animal health improvement and AMR reduction in the Indian poultry sector. After the positive responses from both the Netherlands and India, we have been requested to perform a similar study on the topic of zoonoses. So we see the study to be complementary to the report that has already been made on the AMR reduction in India. In the zoonosis report, therefore, the topic of AMR is only briefly addressed, even though it is of great importance. The main focus of the study was the mapping of policy development, initiatives, stakeholders, challenges, opportunities in India, and specifically the developments after COVID-19 were of particular interest, really to gain a better understanding of how the topic is currently viewed within the country, in politics, public sector, private sector. But of course, we have not limited ourselves to the publicly available reports. We have conducted 19 in-depth interviews in both the Netherlands and India. As the main focus of the study was to map the situation in India, that is also reflected in the number of interviewees. The situation in the Netherlands has been thoroughly covered in the report Zoonoses in het Vizier. I highly recommend reading this. This is made by the Dutch expert group on zoonoses, of which some of the representatives are also present here today. Because this report was very clear and in-depth, the scope of our study was mainly focused on the Indian context. Nonetheless, we have still interviewed a few Dutch stakeholders, both public and private stakeholders, to identify potential fields of collaboration as we move on and learn more about the Indian context. We've tried to include all the perspectives from all One Health dimensions in the report, and a full list of interviewees can also be found in the annex of the report for your consultation. So moving on to Kshiti for an introduction of the context in India.
Thank you, Niels, and it's a pleasure to be speaking to various stakeholders here on the Indian and Dutch side. To start off with, we focus on why India and why the prevention of zoonoses is extremely crucial, not only for India, but also for South Asia and globally. So clearly, with the largest population, the human population in the world, as well as a rapid rate of urbanization, India presents a unique opportunity as well as a challenge. We have a culture, a history, and a context of a close coexistence between humans as well as animals. This is the case for rural and urban India. We have one of the largest populations of livestock and poultry, and this provides livelihoods, important to note, for very small and medium farmers, for indigenous communities, as well as marginalized communities in rural India. So not only are livestock an integral part of society, but they are an important part of providing economic means to the underprivileged communities. And just to highlight that organizations like the International Livestock Research Institution have ranked India as one of the countries with a high burden of zoonotic diseases. The FAO has also highlighted that India and China could become major hotspots for the emergence of newer zoonotic diseases. So, bottom line in the story here is that if we make a change in India that has the potential to impact prevention of zoonoses and policies globally. Just to take a very real example, in, let's say, disease prevention for rabies, we have close to about 20,000 deaths per year, and India accounts for approximately 36% of the global diseases in terms of rabies. So if we mitigate this risk and prevent diseases on the Indian front, that certainly changes the global picture. Next, please. Yeah.
Sorry, you have been muted, Kshiti.
Happy to share that India actually has a long-standing history of taking various initiatives, programs, as well as policies on this front. So if we look at, for example, the Integrated Disease Surveillance Program, which was established with the objective to strengthen disease surveillance in the country. And this is based on various state surveillance systems. The objective has really been to have real-time reporting of data, to have surveillance at various levels, be it at the district, state, or the national level. So clearly the idea is to focus on real-time monitoring, evaluation, as well as actions based on the data collected. As they say, you cannot improve what you do not measure, and you've got to ensure regular tracking and monitoring for the right measurements. In terms of the roadmap to combat zoonoses in India as well, it has been historic because it has called for collective action. At the national level, it's a multidisciplinary endeavor that really ensures the need to measure morbidity, mortality, but more importantly, as Mikhail and Marcel suggested, the economic burden of zoonotic diseases. And the roadmap to combat zoonoses in India highlights the need to take on a One Health framework. In terms of the national Institute of One Health that is going to be established in Nagpur in Maharashtra. It's a very important infrastructural milestone that really conveys India's commitment to increasing preparedness as well as laboratory capabilities to identify novel as well as unknown zoonotic diseases. And lastly, as Marcel also highlighted, the Animal Pandemic Preparedness Initiative lays eightfold objectives, each of which are crucial. First, in terms of disease monitoring and surveillance. Second, in terms of early warning systems. Third, in terms of outbreak investigation and response. Fourth, in terms of ecosystem coordination. Fifth is with respect to vaccine development and R&D. Sixth, in terms of building disaster resilience. Seventh is with respect to ensuring the right funding. And eighth, of course, is the regulatory framework. So on the right-hand side, we see a very clear recognition of India's livestock sector. We see APPI that has clearly acknowledged what kind of an economic contribution can livestock make in the Indian context, but also the kind and the costs of the disease burden that India holds. Thank you. Next, please. Mapping the various stakeholders, while we look at the One Health Consortium that is led by the National Institute of Animal Biotechnology, which is based out of and a part of the Department of Biotechnology, Ministry of Science and Technology. This consortium has various institutes that entail medical research centers, that entail medical universities, veterinary institutions, agricultural universities. So why the consortium is an important big step is because it brings various ministries, for example, Ministry of Health and Family Welfare, Ministry of Environment, Forests and Climate Change, the Department of Animal Husbandry and Dairying, along with very crucial institutes like the National Institute of Veterinary Epidemiology and Disease Informatics. So each of these become very, very important players in terms of the One Health Consortium. So universities, colleges, knowledge institutes, research institutes, they really bridge that knowledge gap and lead to the capacity building. However, to take a step back, India's stakeholders do not just comprise of the One Health Consortium. While this is a core group that is spearheading and leading change, it's very crucial to recognize international organizations. For example, the World Bank, the Food and Agriculture Organization. So as we know, the World Bank has recently approved an $82 million loan towards adoption of zoonotic best practices, as well as in the animal health space to prevent, detect, and respond to zoonotic diseases. So while we have the One Health Consortium, we have international stakeholders, we have private sector stakeholders and players as well. For example, Indian Federation of Animal Health Companies, right? As well as the need to work towards local communities. At the end of the day, the communities that transcend beyond the national, state, as well as go down to the district and the village level are the final stakeholders. So to sum up, stakeholder management and effective coordination poses challenges, but certainly provides a very clear opportunity for each player to contribute to based on their strengths. Next, please. Yeah. In terms of the risks and challenges, we note, so in the report, we've actually done a deep dive in terms of a pestle analysis. So we've flagged the various political, economic, socio-cultural, technological, legal, as well as the environmental risks. So firstly, right, to just pick out a few risks as well as the challenges that then we can address in terms of opportunities. In terms of interdisciplinary and departmental coordination, there's a lot that's being done but there's always room for improvement in terms of each stakeholder stepping out of their own silo and there being greater communication, coordination, as well as information sharing to take greater ownership in terms of tackling the problem of zoonotic diseases. The second, in terms of policy responses, there needs to be a lot greater attention from our political as well as bureaucratic leaders. So, for example, the One Health approach and its importance was reiterated in the recent G20 Health Working Group meeting. And hence, prevention of zoonotic diseases actually needs to be front and center of national as well as international policy discussions. We need to ensure the right compensation schemes at the local level. For example, in case of poultry farmers, if there is culling of birds, elimination of infected animals, of poultry, then the right compensation mechanisms needs to be provided. And this speaks very well to the government's mandate of doubling farmer incomes and speaks directly to that. So policy initiatives in terms of vaccination, compensation, each of these need to speak to the prevention of zoonoses. And lastly, in terms of biosecurity risks, so essentially there needs to be greater knowledge sharing in terms of the kind of biosecurity risks that exist at the local level. As we know, consumers purchase meat from traditional meat shops in India, as well as slaughterhouses where the sale of meat is undertaken throughout the day. This could be, as the picture on the right indicates, these could be open areas, these could be highly unhygienic conditions under which meat is sold, and hence the right kind of biosecurity measures at the local level need to be implemented. Next, please. Yeah. In terms of some of the risks as well, we see that literacy and awareness on the topic of zoonoses in itself is a large elephant in the room, where at the local level, the knowledge is limited to what are the most direct needs. So just to give you an example, there was a study conducted on the awareness and knowledge of zoonotic diseases in Kadapa district in Andhra Pradesh. Limited sample size, and the study reflected that actually awareness in terms of rural as well as urban communities was as low as 28%. So again, this is a very clear risk that can be mitigated through various information communication as well as awareness programs. Secondly, we are a part of a culture as well as geographic, religious, cultural context where human beings and animals live in very close proximity with each other. Animals and livestock hold a very special significance in Indian culture. And hence, I mean, we have elephant gods, we have monkey gods, we worship cows, and these nuances need to be integrated in some of our larger policy responses, keeping in mind the cultural connotations. And lastly, various environmental and climate change risks need to be taken stock of, especially in terms of interaction with vectors as well as wildlife in the Indian context. So, to sum up some of the big picture risks and challenges, these are multifold, but they do present ideas, thoughts, as well as insights on what now, what next, and what can be done in terms of opportunities. Over to you, Niels. Yeah.
Thank you very much, Kshiti, for the clear introduction of the challenges and risks. And the logical next step is looking at the opportunities that flow from these challenges. So on the right side of the slide, you can see what we have dubbed the opportunity ecosystem, which we have developed during the study based on the interviews that have been conducted. We will zoom in on specific elements of the opportunity ecosystem later on. First, as some general comments, I think it is important to keep a few things in mind. So we all know that the challenges that are posed by zoonotic diseases are simply too complex to have one straightforward, simple solution that will magically solve all global challenges. So nonetheless, there are collaboration opportunities across the board that could improve the current situation in incremental steps. So another thing that's important to keep in mind is that collaboration does not mean sending information from the Netherlands to India and receiving information in India, as the Netherlands still has a lot of areas to improve as well. So there's a clear two-way learning opportunity where both countries can learn from each other and also learn together as we progress on this topic. So I think that's really important to keep in mind. So the basis for the whole opportunity ecosystem is the building of bridges and facilitating contact and collaboration, whether this is between the silos that were mentioned by Kshiti, or whether it is between countries, states, health dimensions of the One Health approach, private sector, public sector. It's really about collaborating, facilitating contact, and well, going beyond contact and actually putting your money where the putting your money where your mouth is. Yes, that's the saying. And actually getting things done. So in multiple interviews, we have heard the sentiment that zoonotic diseases are nobody's child. And to figure out who can take responsibility for what, it is important to bring those people who are willing to get things done together, like we are doing today. So at the center of the opportunity ecosystem stands that for successful initiatives, it may be worth selecting a few states for the first pilots or the first exercises, rather than diving on, the whole South Asian continent at once. So we propose to zoom in on Telangana and Andhra Pradesh, as these states have significant roles in the poultry and animal husbandry sectors, and are focus states also of the Dutch embassy in New Delhi. Next slide, please. So in the interviews, a number of opportunities have been identified. Most people see zoonotic disease prevention and management as a real G2G topic, as it has to be made sure that all these lessons learned are also translated into policy. So what is important is that these G2G discussions are based on real data, on science, rather than on short-term political goals or political sentiment. So with a One Health focused network with cross-sector stakeholders, input can be provided for science-based G2G discussions. And this can be done on a wide range of topics. It could be vaccination programs, the enabling environment, stamping out approaches, a wide range of topics that could be discussed are detailed in the report. Another key topic is the improvement of zoonotic literacy that Kshiti also raised in the challenges. This means the understanding of zoonotic diseases at the level that is relevant to the individual. So this could mean for the general public that it is limited to general public health topics, ranging from sanitation to food safety and food handling. While for farmers, processors, healthcare professionals, laboratory workers, it will require more in-depth capacity building. And when looking at this capacity building, it is also important that not one silo with their knowledge provides the capacity building input, but that across the board, the health dimensions work together to provide a well-rounded view of what is important to understand zoonotic diseases. Next, Sophie. Another topic that was raised in multiple interviews was that the mechanisms and platforms that worked well during the COVID-19 pandemic should be translated into systems that are also, that also allow for easy reporting on animal diseases and zoonotic diseases. Use the infrastructure that is there and apply it in a broader sense. To allow for easy data sharing across sectors, but also across borders, it is also important to harmonize the data and the data formatting. This makes information easily accessible and reduces the reinventing of the wheel, which would hopefully speed up the progress. To give an example from the Netherlands, many strategy documents that we have found during our desk research are only available in Dutch. Well, it could be interesting to a much broader public than just those in the Netherlands that are working on this topic. Finally, the network that we propose should be a platform for cross-sector sharing of best practices, technology, research methods, governance structures, the roles of sector organizations, structures between the sectors. This would bring together the willing and able, and also allow for collaboration on both commercial and a public health perspective, as the commercial dimension is also, of course, of interest, as Michiel started with his introduction. If there's technology available in India that could be of use in the Netherlands, it is good to bring together the parties that are able to supply this, and also the other way around, of course. So we briefly touched upon some of the opportunities in the report. Of course, we could not summarize a complete 70-page report in just a few slides. So feel free to dive deeper into the report. But I think that these are some of the most important topics that we need to address here today. So Davinia, back to you. Let's move on to the discussion and open the floor.
Yeah, I think Marcel, Michiel, Niels, Kshiti, thank you for your input and for this presentation. I think from now on we set a little bit the scene, and we now would like you to have the floor and ask questions, but also start the discussions with the embassy and with us. I already maybe we could. First, I would like to ask if there are already some questions that need to be answered, and afterwards we have this Mentimeter idea where we have a certain question for you. Hopefully it would work, but let's first start with general questions. Is there already somebody who has a question that needs to be raised? Can you, if you have the question, please raise your hand.
Yeah, I do have.
Yeah. Please go ahead.
Yeah, hi. I introduce on chat. My name is Vijay Makhija. So I'm the representing INFA here, the president of INFA. So couple of remarks. So very good presentation so far and insightful ones. So we'll suggest that to include the name of INFA in your slide deck. We being the largest animal health association in the country with a membership of more than 50 members, and we are globally affiliated with Health for Animals as well. And second point was about the vaccination and biosecurity. So we have a dedicated subcommittee which focuses on biological and biosecurity range of products. So there we can be very open for any collaboration, because vaccination and biosecurity has a very big role to play for minimizing zoonosis. So these are my two quick comments. Thanks.
Thank you, Vijay. Anybody else? Yes, I see another hand raised. Please unmute yourself.
Yeah, can I speak?
Yes, of course.
Yeah. This is Anand Kumar. I'm a professor of veterinary microbiology from Andhra Pradesh. And indeed, it is a pleasure to join. Our laboratory has completed this Indo-Dutch pilot project on AMR in Andhra Pradesh. That was the first attempt under One Health approach in the Krishna district of Andhra Pradesh. Our lab executed animal health and environmental components, and along with a medical college in Vijayawada. That's a good initiative under Indo-Dutch joint collaboration in health. Looking forward to take up this under One Health approach issues in the Indo-Dutch setup. We are ready to work with any aspect under One Health. So we want to continue further also. Thank you.
Thank you. Somebody else before we? Yeah, no. I don't see any more hands raised.
Dr. Mohan has his hand raised, I believe. Go ahead, Dr. Mohan.
Madam, there are two issues. One is community engagement, and second one is physician burnout. These were neglected earlier, even during COVID time.
Okay.
And net result is almost about 30% of the physicians, doctors, they stopped to practice later because of the burnout. So this has to be considered for veterinarians also, sir. And coming to community engagement, there are various procedures for engaging successfully the community, which were not at all considered during COVID time. So they need to be considered in this project.
Okay. Anything to add to that, Kshiti? Any suggestions?
Absolutely, Davinya. I think the points mentioned on community engagement are certainly one of the larger opportunities that arise in terms of where the collaboration area lies. And of course, I mean, the response to COVID, but also overall in terms of prevention of zoonosis, shows us that the field practitioners, the ones that are actually implementing at the community level, there needs to be enough checks and balances to prevent a burnout. Yeah, I think Dr. Deka, there's a couple of more hands raised. Yeah.
Yes. I see Chantal.
Yes, yes. Can I add 2 points?
Yes, of course. Please go ahead.
Actually, I'm Dr. Chanchal Bhattacharya. I'm the nodal officer of zoonotic diseases in Delhi government, and I'm practicing One Health for a very long time. So I wanted to point out 2 things. Number one is intersectoral coordination in our country is very poor, because I have experienced many times. So when I was fighting with avian influenza or glanders or other zoonotic diseases in Delhi. So I have found out that there is a very less intersectoral coordination in our country. That is very important. We have to take care of that, and we must strengthen it. Number two, in Southeast Asia, the wildlife zoonosis is very neglected. Wildlife diseases are very neglected, and we need to take these wildlife diseases into our One Health approach. Otherwise, the next pandemic may lie in wildlife. Most of the specialists throughout the world, they are already giving signals that wildlife will be the base of next pandemic. So we must take care of that. I think that we must strengthen the wildlife disease facilities, and we must take care of the capacity building in case of wildlife diseases also. Thank you very much.
But I agree with Dr. Chanchal. Sorry. I agree with Dr. Chanchal, because I had very bitter experience with the intersectoral coordination. When Gujarat South, 4 districts are suffering very bad with leptospirosis, to bring intersectoral coordination and for vector control, I took 4 long years when Modi ji was the chief minister of that state. And we always ignore the intersectoral coordination, which is very, very important. Secondly, as he said very rightly, wildlife is never considered. That is the issue. And if you see the fringe areas of the forest areas, you will find many zoonotic diseases people are suffering, and animals are also suffering and dying also. So definitely we have to do something for this. This is Mohan Rao from Hyderabad, madam. My name is not displayed here. That is why.
Thank you, Dr. Mohan, for your input, and also Mr. Chanchal. I think it's indeed something that needs to be on the agenda. I see a couple of hands raised. Ram Team.
Yeah. I'm Ram Pratimdeka. I'm from ILRI, International Livestock Research Institute. I wish to make basically 3 comments. Number one is my previous 2 commentary mentioned about the poor coordination, intersectoral coordination. This would not automatically happen if we discuss among the technical people only. We need to take it up with the policymakers. We need to convince politicians as well as senior bureaucrats. This need to be initiated by policymakers and top bureaucrats to make things happen on the ground. And another point I wish to make is basically in states where you wish to work, you may try to have a intersectoral task force to investigate any emerging disease, so that they can understand, and you can need to put resources so that they can this or no effort to go collectively. Human, animal, and environmental health professionals are collectively going together to investigate the disease, and you have sufficient resources to do that. Then it would make some senses. Second or third point I used to make is, while you think of state selection, probably it would be good if you select two different set of states, or two just states. One is very good in livestock development, and another one is poor in livestock development, or one in middle of the country, or one is in bordering areas of the country. And then in case of disease priorities also, I would suggest that you should not think Zoonoses as such. Probably you can consider the most, you can, before this one identifying the disease, you can have a secondary evaluation to identify the priority disease in that particular state, and you can have more deeper investigation on the subject. And instead of, our approach should not be to make a lot of hue and cry, which will which will prevent or which will discourage the consumers and other people to have livestock product. Rather, we should involve in deeper investigation to identify the solutions, how to address the problem, so that while the people comes to know, okay, there is a risk, also they know there is an opportunity to address risk. So over from my side.
Right.
Thank you, Ram. This is very valuable input. We take it into account. Yeah, maybe I can go to Dr. Rayeshwari, because I think he's also raising hand, and afterwards we go to Annabelle Daburon.
Yeah, I'm Dr. Rajeshwari Shom, Principal Scientist from ICAR, Indian Council of Agriculture Research. My institute name is National Institute of Veterinary Epidemiology and Disease Informatics, located in Bangalore, India. So, ma'am, my question is, for almost 15 years, I'm working on zoonotic diseases, especially on brucellosis, and recently we added into our research area AMR, antimicrobial resistant pathogens research, as well as Q fever. So why my experience I would like to share. My experience I would like to share is there are so many international organizations. We obtained funding for our research work. Suppose, say, for example, CDC, which funded an anthrax and AMR, Indo-UK, which funded on IMR pathogens, ILRI, international, my friend is there, Dam Pratim Deka. We worked on Q fever, brucellosis, and AMR. And FAO, for a laboratory capacity building project across the country on AMR pathogens for FAO. Now it is your turn. So my thing is, everyone is talking of One Health, intersectoral collaboration, and some of the zoonotic diseases burden, policies, and things like that. So I just, these are all the common things we have been discussing over a period of time, over a decade or so. So a pinpoint a need for the India, pinpoint need for the Netherlands has to be mutual interest. Threats first has to be identified between these two countries, and need for the research and strengthening of the research and handholding of the research for a long period of time. And that is on mutual basis, it has to continue. Otherwise, running a project for 2-3 years and leaving is not going to fulfill the objectives of One Health. Thank you, ma'am.
Thank you, Jaswari. I think it's indeed something that we need to further investigate. Maybe over to you, Annabelle. Maybe you can have a link with this.
Yes, thanks a lot. So I'm Annabelle Daburon from Wageningen University and Research. I'm a livestock value chain advisor, and I'm engaged in several activities on capacity building, mainly with Global South partners in One Health. And so I just wanted to make 2 points, reflecting a bit on what you mentioned. One of the previous participants mentioned on the idea of really engaging with local policymakers, because I think it's really like the kind of the connecting gaps. Often you have like national policies, but we miss action pathways, processes to bring zoonoses in the forefront of those local policymakers and to push it in their agenda, because they have a lot of competing priorities. So I think working on those, how to operationalize really at local level, I think it's really one of the major priority. And another point I want to make, it's on the capacity building agenda. So policymakers, practitioners need to be trained on how to adopt more One Health approach, more systemic thinking. But it also, so not only focusing on, let's say, content on zoonosis, but also on processes. So how do you work together with a different background? How do you engage with stakeholders and how you build collective decision? So, and this process of working together in a One Health setting, I think it's also a strong, an important dimension to take into account in capacity building trajectories.
Thank you, Annabelle. Do you already have examples or things that work?
So in terms of what may I ask? So
yeah, for example, in capacity building. Yeah.
Yeah. So in capacity building now we are. I'm running a course now since 4 years with practitioners from Africa or Southeast Asia. Where we bring together people from both veterinary sciences, plant sciences, human health sciences, and the idea is that we make them reflect on their own context-specific challenges. And by working together, you kind of help them to understand that often you can find common solution, adopting multi-stakeholder processes. And that's one example where you kind of build creative solution, connecting people from different sectors, and they kind of learn how to engage with stakeholders from not their own field. So vets learn to connect with human health medicines, or with plant health, talking about, I don't know, pesticides, residues, alpha toxins, and so on. And another example, we are just starting now, so it's not yet a proof of concept, but we are starting in Kenya a new project where we will try to bring together One Health community unit, One Health, yes, county units. So it's like local One Health units, and the idea is to help them to facilitate, to train them on One Health and zoonosis and food system approaches, and support them to identify zoonotic strategies to prevent zoonosis in their own context. So yeah, that's kind of 2 examples that we have.
Interesting.
Now.
Thank you so much for this input, Annabelle. Dr. Mohan Rao, I see another question from your end. One question or one remark.
Madam, actually, technology development is one aspect. Technology dissemination is another aspect. Now, my suggestion is the community engagement, we have not done enough for COVID management. See, what is happening is, you know very well, in a community, different types of people are there. Innovators, early adopters, late adopters, and laggards. They were never taken care of. So that is why, on one hand, scientists can develop the technology. On the other hand, extension scientists must devise methodology by which the technology reaches everybody, even doctors and nurses, and then public. Public last, of course. This is my request for our project.
Thank you. Thank you, Dr. Mohan. Maybe because I think for today, it's important that we capture all this important information, that we use the Mentimeter to register this. So you've seen the screen already for quite some time with the QR code. Rogier has also put it in the chat. Please put your input via this platform so that we can capture all all your ideas. Maybe Rogier, can you already share something? I don't know if everybody has. Maybe we can have 1 more minute so that people can fill it in, and that you can share the results. I'm looking at Rogier.
Yes, of course. I already see some comments coming in. So
okay,
looking for some more comments.
Then in the meantime, Ram, Pratin, that you had another question or remark? I see your hand is still up. No. Dr. Mohan, you have still 2 hands up. Oh.
And just to kind of highlight, Davinia, for those who still are trying to figure out Mentimeter, please click on the link www.menti.com. Post that, please enter the code that's been posted here in the chat box by Rogier. So that's 29005238, and post that. You can input some of your thoughts, ideas, suggestions on the question that's posted on the screen.
Thank you, Kashiti. Rogier, is it coming in?
Yes, it's coming in. So maybe 1 more second.
Okay. Shared my views. Okay.
Okay, here we go.
Yeah.
So the results.
Okay.
We see biosecurity in the center. So a lot of people have added biosecurity.
Joint market research, public awareness, and indeed that also came through. Surveillance. Yeah. Yeah. I think very, very interesting, very good information. Anything to add? Because maybe then it would be good to go to the second discussion. No, nobody.
Oh, I see
Then
Ram with a question. Ram,
do you still have a question?
No, sorry.
No, no. I think his hand is still up. Yeah. So this is the next one. How can you or your organization contribute to collaboration between the Netherlands and India? Please again use the mentimeter.com, and this time a different code number 21160265. We'll give you a couple of minutes to fill it in. So 21160265. Coming in, Rogier?
Yeah, I see some coming in. You can scan the code as well. So use your smartphone. So that's another option. I see some very nice suggestions coming in.
Okay. Yeah, can you already share it, Rogier?
Yes, of course.
I don't see it yet.
So
yeah.
We see capacity building as a center part.
Set up monitoring, seminars, workshop. Maybe this is a nice bridge to you, Michiel and Marcel, to finalize this webinar, because I think a lot of things have been said, and I think there are some good ideas, and I think this platform of specialists is a very good starting point. So maybe your thoughts on this, Michiel and Marcel, starting with Michiel.
Thank you, Davinia. Well, first of all, big compliments to Kshiti and Niels. I think they did a wonderful job in presenting it. I've seen them work on the report. Really highly appreciated. What I see in this small setting is more or less one of the roles that I see for myself. It's facilitating, it's bringing people together. I really hope that based on this first experience, and that's our role, that things will start working. I see it as my role to put zoonoses on the agenda. I mean, if you would have asked me 2-3 years ago about zoonoses, I would have said, excuse me, how do you spell that? Now I know. That really helped me. I have some feelings where I can touch upon. I heard excellent interventions from some of the partners. I would almost ask in the final draft maybe to put in 2 pages, for example, with the clouds and some overview. Okay, we had a discussion, who the participants were, if they all agree to that. One of the things that I may have been missing, I've been trying to write down all the participants, but that's more or less also a bridge to Marcel maybe. That's the human side. I've seen many fantastic participants on the Indian side, and of course on our Dutch side, which are mainly on the animal side. But I think it's so important, and it's talking about silo breaking, which is one of the most challenging things, I think. It's that where can we get this interaction between human and animal side. I've listened carefully also when Dr. Ram, I think it was, who mentioned that, well, look at a selection of states where there is a poor policy and there is a strong policy. Well, we'll look at it. Of course, we have to try to combine it with what we as a Dutch embassy, as the Dutch government, try to focus on within India. And I think that Dr. Mahan had a very fair point on saying, well, we can develop all the technology that we want, but the dissemination, the knowledge transfer will be a very important one, because otherwise, whatever technology we have, we won't manage that. And maybe finally, the idea of that Annabelle was proposing about, well, not the idea, but the action that she is doing, training policymakers, having the exchange between policymakers. Also, as we are today, we have several policymakers from the Ministry of Health and from the Ministry of Agriculture from the Netherlands. I do hope that they at least enjoyed the webinar. That's one thing, that they will have taken knowledge of the report and of the opportunities that exist in the cooperation between the Netherlands and India in improving the situation. So just a few thoughts that came up from me, finalizing once more to thank Larive and Seamless Global for the fantastic work that they have done. Thank you, Davinia.
Thank you, Michiel. Before I go to the final word from Marcel, I see one more question from Dr. Mohan Rao. Please go ahead. You're muted. Dr. Mohan, you're muted. I don't. It's not working. We don't hear you. Then maybe over to Marcel.
Yes, and audible?
Yes.
Well, perfect. First of all, I'd like to echo Michiel's words of thanks towards Larive and the Siemens Group also for hosting this webinar, which bring different elements to the table, more specific, and with engagement of all the participants of this webinar, which adds to the knowledge that we try to collect and collate in this report. For me, key takeaways very much about connecting the more technical level and expertise towards policy and vice versa, in which we can, I think, as an embassy, can be instrumental. At least that would be on my to-do list. Absolutely. In connection to that, second point would be, I think there's a desire to bring the whole system in the room, which is not always a common practice here in India, nor in the Netherlands, but there's no alternative. If we really want to make progress on such complex issues as we're talking about, we need the whole system in the room. So mobilizing, convening power it would be second on my list for what we can play a role in the coming period. Because essentially, what I hear is we have to get to know each other. Apparently there's a gap in understanding one's background, way of thinking, and we need to start working together on the basis of trust and mutual understanding, and that is something that you can organize to a certain extent. Third point, very, very relevant, about community engagement. That will only work, will only fly if we increase awareness. So it's most likely you can do it, and you have to do it but the guidance of, for instance, Annabelle, and that would be absolutely fantastic. Working on awareness and at the same time see how that can lead and trigger a community engagement. So those were my key takeaways from this hour. Thank you very, very much, Davina. Over to you.
Okay, well, thank you, Marcel. Thank you, Michiel. Thank you, Seamless team. Thank you, Niels and Rogier. I think really did a wonderful job. I think we have a very clear and good report as well on zoonoses, and prior to that, we have, of course, the AMR report. Let's see this as a first platform to continue the discussions. I would like to thank you. We will send over the presentation. Again, the report, if you have not yet seen it, and we'll discuss with Michiel and with Marcel on the next steps. It's in their hands, but I think this is a good first step, and this is a good platform to start with. So thank you so much. Hopefully see you next time, and for now, wishing all of you a good day. Thank you. Bye-bye.
Thanks a lot.